Hi, I'm Pam Norley, and today I'm joined by Sheila Davis, the CEO of Partners in Health, a nonprofit global health organization. Partners in Health focuses on serving those who wouldn't otherwise have access to quality health care. And Sheila joins us today to talk about how Partners in Health has been involved in the fight against COVID-19, how it's affecting the work of the organization, and ways that people can help right now. So let's dig in. As a global health organization, Sheila, with experience in treating disease outbreaks, can you describe what it's like being a first responder to COVID-19?
Yes, thanks so much. I'm happy to be here. So we work in 12 countries around the world. So we have doctors and nurses and community health workers and drivers. We have people on the front line in all of those countries providing care, since we provide care normally and have hospitals, have health clinics, and work in the community. So we've had to add on doing COVID on top of our already normal healthcare delivery. So it's been a challenge, particularly in places where the level of hospital care is not as great as it is in the US, for example. So that's been a huge challenge. We have also started working in the US a lot more since COVID and are working in Massachusetts as well as a number of other states.
In Massachusetts, we know that your contact tracing is key to controlling the spread of this, and you've done some great work on that in Massachusetts. Can you tell us more about this unique partnership?
Yes, this was really a unique opportunity. And I think because we have history in pandemic control in other countries with Ebola in West Africa, which I was very much involved in cholera in Haiti, in multi-drug resistant TB in a number of countries, contact tracing is something that we have done for many, many years and have experts all around the world. So in Massachusetts, when the Governor Baker asked Partners in Health to become involved and join a part of a consortium, which includes the local boards of health, Department of Public Health, as well as a number of other government agencies, it was really a unique opportunity to bring lessons learned globally to the US setting.
Our donors are very interested in helping support any type of response to COVID-19 with a sense of urgency. How can they support contact tracing efforts?
Contact tracing is one piece of the puzzle, and it's important that along with that is the ability to have safe isolation or quarantine. So we've found in Massachusetts, for example, that about 20% of the people who are outreach workers or calling are saying they're unable to safely isolate because they don't have food, they don't have the ability to get medications, they're living in a place which is very crowded, for example. COVID-19 has disproportionately impacted the most vulnerable communities where there's often people living in many people to an apartment or don't have the ability to safely isolate. So contact tracing is one piece of it, but there also has to be aggressive testing campaigns. There also has to be the ability to safely isolate. So we're really advocating that we support the efforts that are going on in Massachusetts and other states certainly, but also look at where do we need to supplement that with organizations like Partners in Health, like other food banks, et cetera, so that we can make sure that people have what they need to safely address this.
As a nonprofit, how has the pandemic changed how you operate?
When word first came out about this epidemic in February was when I think the world started to pay attention, although obviously it had been in China for a while. We aggressively worked a lot on supply chain. Getting the gloves and the masks, et cetera, is really challenging and costs us a lot of money. We spend millions of dollars on protective equipment for our staff because they are definitely on the front lines and are working in settings that are already at risk with not having running water, many of them. Certainly there's not ICU level care. So life is just harder. Delivering care is harder. So we are definitely trying to build up those systems as much as we can and address the pandemic, as well as still delivering babies, still doing emergency surgeries. So funding is critical to that.
What makes you feel optimistic about the future as you consider some of the challenges that you've been dealing with in responding to the virus?
I'm an eternal optimist, so I believe that we're continuing to learn. And I think COVID has really shown that the US doesn't have all the answers, and we need to listen and learn from other countries. And we also have a lot to share. So the bidirectionality of global health and the bidirectionality of what we need to do with pandemic control, I think is critical and is a place where we can really look at augmenting that for the future. In terms of the US, what's happening here, hopefully this has shown that really the most vulnerable populations in the US are so disproportionately impacted. And that's not just COVID, it's all health outcomes and health indicators. So should we as a country use this inflection point to build a more robust public health system that can access and make sure that we're having and taking care of those who need it most? And I think we can do that. I think it takes political will. I think it takes innovation and being willing to look at our current health system and say, should all of our efforts be around hospitals?
And Sheila, finally, what are 3 things that people can do right now to help with the medical needs created by the pandemic?
I think number 1 is look at where can we be supporting the most vulnerable communities in our areas, and whether that's through nonprofit organizations like Partners in Health, whether it's supporting food banks, what we can be doing to make sure that there's access to care for all who need it most. I also think being aware that this is impacting globally. And I think it's important to keep our eye on that. There's no ventilators in the whole country of Liberia. There's in Haiti before COVID, there was 11 for a country of 11 million people. So I think continuing to commit to building health systems in other places in the world is really important. One, for the moral part of it and for all of us seeing each other as human beings. But secondly, we're a global world, and the stronger health systems are in other places in the world, the better that's going to be for epidemic control, for any type of infectious disease. If people look at just the strength of other health systems and other places where pandemics tend to take hold, and we strengthen those as much as possible, then the better off all of us will be. And I think thirdly, really trying to do what we can to stop this epidemic here in the US. And a lot of that is adhering to wearing masks, washing hands, being aware, doing social distancing. We have to continue to do this.
Sheila, thank you so much for joining us here today.
Thank you so much.
Thank you.